The Joint Commission Center for Transforming Healthcare has launched a project to improve the care of patients with heart failure. And we are doing that because we want our hospitals to partner in new ways with their physicians to create the right support functions that patients with heart failure need in order to stay as healthy as they can be.
I think the starting point is saying, put yourself in the patient's shoes and start thinking about what simple things would you, if you were the patient, be able to do that might stop you coming back into the hospital.
This is not about the hospital, but this is about their health, well-being, and their quality of life, and what we can do to build a better system to help support them.
Oftentimes patients who have heart failure find it difficult to control their weight, to control their salt intake. As a result, they end up having more problems with shortness of breath. They can't get around as much as they should. They can't climb stairs. They can't walk distances.
Also, patients with heart failure can get into trouble very quickly. They can feel good one day and then within the next 24, 48 hours really have a fairly rapid turnaround and start to deteriorate.
Readmissions is a major health problem. It's been a target of Medicare and Medicaid and other third-party payers. So it's something we've got to attack. We don't have an option.
Patients with chronic illness are not managed very well today because of the fragmented way in which they receive care from many different sources over long periods of time.
We have such a large, dynamic healthcare system in the United States that definitely has opportunities to provide better coordinated care, to make better connections between what happens in the hospital and what happens in the physician's office.
Heart failure is a good example where there's a lot of knowledge about how to manage heart failure, but the dissemination and the availability of that information at the point of care and the collaboration with the inpatient environment doesn't always happen seamlessly.
We're talking about improving the quality of life for these patients, their ability to live with heart failure and reduce the likelihood of its advancement.
It's a combination of the condition that the patient has, which is usually fairly complicated, but it's also the social structure around the patient and also the system that supports the patient.
It's something that we collectively need to do and partner with primary care, partner with community centers to figure out how can we deliver a complete healthcare experience for heart failure patients and not be driven by the revenue that's generated from seeing patients within our four walls.
The future of medical care is trying to shift patient care to the outpatient arena, which is more appropriate for much of what we're doing, more cost-effective for what we're doing. Patients are happier, hospitals are happier, payers are happier.
If this collaboration is successful, we'll be able to identify the ways in which we can help people with heart failure avoid complications of their condition, avoid hospitalizations when they were otherwise preventable.
The accountable care organizations need to be able to deliver accountable care. This project will provide the tools by which they can deliver accountable care for patients with heart failure.
But I think we've got to figure out how we do listen to the patient and do what they want rather than what we think they want. That's the challenge.